In conducting door-to-door fieldwork, resource economics and public policy professor Sylvia Brandt is amassing a body of data that shows that environmental harms are unequally shouldered, both locally and nationally. Featured in the European Respiratory Journal and highlighted by the National Institute of Environmental Health Sciences, her work is revealing that children living in low-income communities and in areas with larger minority populations are exposed to higher levels of pollution and are at much greater risk for asthma.
Asthma is a condition where having asthma cuts across race, ethnicity, income, but being sick from asthma, it varies very substantially with socioeconomic characteristics. We know a lot about preventing asthma attacks. The medical knowledge is quite deep and rich. What we don't have is a way to take that knowledge and improve the quality of life of children in the United States. And that's because we don't really understand the complexities of what happens in the household.
From nearby Springfield to several communities in California and beyond, Brandt's research puts a dollar value on pollution and its exacerbating effects on asthma. By speaking directly with affected families, Brandt illuminates the costs associated with these struggles and communicates them to the greater public.
I actually started working in Springfield because I was interested in looking at how asthma education or asthma intervention programs affect the morbidity of asthma. By morbidity we mean basically how sick the kids are with their asthma. And also, Springfield is considered a hotspot for asthma. It's one of the classic places where you see the rates of kids having asthma much higher than the general population. So in the nation, we have an average rate of asthma prevalence about 10%. But in places like Springfield, we have areas where schools have more than 20% of the kids have asthma. And the kids who have asthma also tend to be more sick than the kids who are in similar physiological conditions or have similar physiological conditions but live in other places like, say, a suburb of Amherst in this area. One paper that was published in 2012, and that was an Environmental Respiratory Journal, was looking at the cost of pollution in two communities in California. One was Riverside and one was Long Beach. And what we did was the epidemiologist basically constructed the ratios of the children who have asthma that can be attributable to exposure to pollution. And then among those kids, how many of those asthma attacks are related to pollution versus other causes. And then what I was doing as an economist was looking at, well, what does that cost those families? So what does it cost in terms of days lost from work, days lost from school, the cost of the medication, the cost of them going to the emergency room. And then on top of that, we're also starting to look at the question of what is the psychological burden of having asthma. I think knowing that on average, the price tag of asthma for a family is $4,000 is really persuasive, because what that means is that households are spending 7 to 10% of their median take-home income just to treat a single child with asthma. That is a big chunk of the budget. And if we talk about policies that really affect American families, we should think about policies that can reduce that burden.